Hello, everyone. I would like to welcome you to EMRA's information session video for spring 2023 recruitment. My name is Shivam Rana, and I'm the primary program lead for EMRA this year. And I just want to jump right into it. Hopefully, you guys find this information session video informational, and hopefully it gives you some questions to ask us in our live information sessions. Next slide, please. So why do we exist? The single largest impediment to prospective EM clinical research is the ability to collect data. So prospective clinical research is kind of the gold standard of research. And this means that when patients come into the emergency department, we catch them for specific studies. And that's what we do. We are the net in the emergency department that screens patients that come in, and we're the ones that kind of get that whole process rolling. Next slide, please. Our vision is to advance the practice of emergency medicine through clinical research. Our mission is to assist with ED faculty conducted clinical research studies and provide volunteers educational opportunities for professional development.
We are so lucky to have extraordinarily involved faculty sponsors, Dr. Cooper, as well as Drs. Maurer, Hendy, and Schreiger, who serve as our physician advisors and the PIs for many of our studies in EMRA. But to be clear, EMRAs get exposure to the entire ED faculty and interact heavily with all of the emergency medicine residents. I've been in EMRA since my freshman year at UCLA, so nearly 4 years. And one of the most special things about this program I've felt throughout my entire involvement has been the mentorship and community we have within the ED. The department really does treat us like part of the ED family and goes out of their way to assist us with our mission. It's a very special thing. Next slide, please. We are a team of about 45 clinical volunteers of all ages, majors, and years, serving as the eyes and ears of the emergency department and executing its clinical research on the ground. I'm now going to pass it off to Tarka to tell you what we do not do.
So EMRAs are fortunate to engage with a diverse range of clinical research-based and pre-professional development opportunities. Although we assist with clinical research, it's important to note that we are not healthcare professionals, and our scope of duties does not involve direct patient care. We do not provide any medical advice, nor do we assist with diagnostics or intervention. Although we do assist with research, it's important to understand that we do not perform extensive data interpretation and analysis. That being said, there is a lot of amazing things that we do have the opportunity to do as EMRAs, and Fred will be speaking more on that.
Thank you, Tarka. Now I'll spend some time talking about our duties. As EMRAs, we play a very important role in the execution of clinical research at UCLA Ronald Reagan Medical Center. We are currently involved in many ongoing studies, and although they each have their own specific protocols and guidelines, what I will mention here on the slide are, for the most part, universal and are at the core of what we do. We screen for qualifying patients, communicate with healthcare staff to determine patient eligibility, assist in obtaining informed consent from patients, and for some studies, collecting data. Overall, for participating in EMRA as a contributing member of a large research team, we allow you to learn many skills that can be carried forward to a future in healthcare, academia, or industry. I will now be passing it on to Ursal.
I'm sure you are all wondering what EMRA has to offer you as potential members. So some components of the EMRA experience include exposure to clinical research, shadowing, observational opportunities in the ED, and opportunities for professional growth. EMRA is also a platform for members to grow and pursue different endeavors through our committees. As you can see, we offer a range of other resources that serve our members. A few include EM conferences, physician mentorship opportunities, and amazing helpful peers who share a passion for healthcare. Now I'll hand it off to Carl to discuss our completed studies.
EMRA's work is a powerful contribution to the clinical research that's conducted at UCLA's Department of Emergency Medicine. For some of our multi-center studies, UCLA is the top enrolling site, and EMRAs are doing the entirety of patient screening for those studies. Up here is just a very small subset of the many completed studies that relied heavily on EMRA's work. For example, crystalloid, liberal or vasopressors, early resuscitation, and sepsis was looking at different treatment regimens for the very severe condition that is sepsis. And for this study, EMRAs carefully monitored patient vitals and coordinated with the care team in real time to look for qualifying patients. Outpatient venous thromboembolism management was looking at the efficacy of different anticoagulants. And for this study, EMRAs had the privilege of identifying as well as formally consenting patients into the study. The whole blood study was looking at the benefit of using whole blood as opposed to blood components for massive transfusion cases, and EMRAs were responsible for going to these cases, collecting the blood, and assaying them for clotting abilities. There's a team of EMRAs that even published a journal article that was detailing the EMRA program's history and impact, and our work as a program has been acknowledged in other publications as well. Overall, we have a very rich impact in clinical research, both historically and with our current studies. Now I'll pass it off to Vi to talk more in depth about one of our recent studies.
Thank you, Carl. So one of our past studies was emergency medicine palliative care access, which is also known as EMPALA. It was a study that culminated in the spring of 2022, so very recently ended. Emergency department initiated palliative care has been shown to improve patient-centered outcomes in older adults with serious life-limiting illnesses. However, the optimal modality for providing such intervention is relatively unknown. EMPALA was a 2-arm multi-site randomized control trial that sought to investigate how different forms of palliative care can impact patient and caregiver burden and outcomes. Specifically, the study compared nurse-led telephonic care management to outpatient palliative care for adults with serious illnesses. Now, I will pass it off to Elsa to discuss some of our current studies, specifically abdominal CT.
Thank you, Vi. I'm Elsa, one of the study heads for ABCT. This is a largely observational and evaluation-based studies where EMRAs gather data through incoming non-penetrating blunt traumas by assisting in the completion of the ABCT questionnaire, the proposed clinical decision instrument that can help reduce excess radiation exposure. The two components of this study's questionnaire, the resident completed and EMRA extracted data for each enrolled trauma, are then logged into our database by EMRAs. This study is interesting because EMRAs have the opportunity of spending time in the emergency department bay with the trauma team and observe the emergency department's protocol to handling a trauma. I'll now hand it off to Shivam to discuss the ICECAP study.
All right, thank you, Elsa. Now I'm going to discuss ICECAP, as Elsa said, or influence of cooling duration on efficacy in cardiac arrest patients. So every year, over 380,000 patients suffer from an out-of-hospital cardiac arrest, and that's just in the US. So protecting the brain from ischemia or a lack of blood flow during cardiac arrest is extremely important. Prolonged ischemia can lead to devastating neurological deficits. So one of the approaches kind of to prevent this is through cooling. Cooling in comatose cardiac arrest patients with shockable rhythms has been thought to improve neurological outcomes. And that really brings us to ICECAP, which is a multi-center randomized clinical trial, which aims to determine if increasing duration of cooling to induce hypothermia in the patient is actually associated with better neurological outcomes. The trial also aims to identify the optimal duration of cooling. As EMRAs, we will be screening for potential cardiac arrest patients, potential post-cardiac arrest patients, and assessing if they are eligible for the study based on the patient's current cooling status, among other factors. I'll now hand it off to Emmy to talk more about our fentanyl study.
Thanks, Shivam. Hi, everyone. My name is Emmy, and I'm one of the 2 study heads for fentanyl research study. Fentanyl is EMRA's opioid overdose research study, and it's a multi-center observational study that analyzes fentanyl overdose in the emergency department. Fentanyl is a powerful opioid, and its analogs, otherwise called fentanylogs, are unregulated and heavily abused. That leads to preventable cases of overdose in many communities. Since the number of drug overdoses from these novel psychoactive substances have increased in the past years, this study aims to identify and quantify the intake of fentanyl among patients presenting with an overdose to the ED, along with evaluating the consequences of fentanyl OD and geolocating any trends regarding this outbreak. Our role is that EMRAs screen for patients with relevant chief complaints and identify patients through their blood sample to present to the ED with psychoactive substance overdose. We then immediately alert our PI, Dr. Levine, who will enroll the patient. I'll be handing it off to Sarah next to talk about YPIC.
Hello, everyone. My name is Sarah, and I'm study head for one of our newer studies, which is called YPIC, or Youth Partners in Care for Suicide Prevention. Adolescent suicide is actually the second leading cause of death among U.S. youth, ages 15 to 24. So youth with serious suicidal behavior or thoughts often present to emergency departments, but evidence is limited regarding optimal interventions for reducing their risk of future suicide attempts. So really the purpose of this study is to compare two evidence-based interventions to see which one is more effective for reducing suicide attempts. The first one is Safety Acute A, which is a crisis therapy session focused only in the ED. And the second intervention is Safety A and a coping long-term with active suicide program that's known as CLASP. And it's comprised of a brief therapeutic follow-up contact after discharge from the ED or hospital. So our role as EMRAs is really to screen the ED track board to identify eligible patients to present to the ED with suicidal ideation or behavior and notify the SRAs about enrolling these patients. I'm going to pass it off to Carl for Aster.
Thank you, Sarah. I'm one of the study heads for Aster, or acetaminophen and ascorbate in sepsis, targeted therapy to enhance recovery. So Aster is a multi-center interventional trial that enrolls critically ill septic patients. Sepsis is a life-threatening condition that involves a dysfunctional systemic immune response to an infection. And as part of that systemic dysfunction, there's excessive release of inflammatory signals. There's a lot of oxidative damage occurring, which causes bulk cellular injury that then escalates to potential organ damage and even failure. Now, it's thought that acetaminophen might reduce some aspects of these pathways and oxidative stress in sepsis. So to formally investigate that, Aster assesses the efficacy of acetaminophen infusion for minimizing organ failure and extending days alive for patients who have acute presentations of sepsis-induced major organ failure. Within this study, EMRAs are involved with gathering very detailed medical information across multiple stages of a patient's admission, and also coordinating with nurses across that information to identify patients who might qualify. I'll now go over a related study that we're also involved with. Aster Bunch is an extension of the Aster trial, where Bunch stands for Biomarker Evaluation in Acetaminophen Treatment from HME Filters. So this is a multi-center prospective study that extends the Aster trial, and it's evaluating the mechanisms by which the intravenous acetaminophen can affect lung injury within sepsis. Aster patients who might have lung complications could require mechanical ventilation. And when that's the case, their exhaled breath in this ventilator circuit is going to collect on a heat moisture exchange filter, or HME filter. These filters can then be collected to analyze that exhaled fluid for protein biomarkers of lung injury and inflammation, and thereby we can investigate the potential mechanisms by which acetaminophen is protecting against lung injury for these septic patients. So for this study, EMRAs are responsible not only for screening for our qualifying patients, but also closely coordinating with nurses and respiratory therapists to set up, collect, and transport these study filters all the way for our downstream analysis. Now, having reviewed these current studies, we can go on to talk about EMRA's many committees.
So I will be talking about the Research Committee, which is one of EMRA's oldest committees, and it focuses on providing a space for EMRA members to further their knowledge of clinical research and discuss topics that they're interested in. At the heart of the Research Committee is our journal clubs, which we hold 4 of per quarter. Here at these journal clubs, members present recently published papers about any topic in clinical research that they are interested in. And as a group, we discuss the paper's methods and findings, as well as its limitations. We also have other opportunities for members to discuss, such as presentations at UCLA's Undergraduate Research Week Poster Day. We also host research fundamentals workshops where we do projects to learn about all aspects of research, including statistics, protocol design, grants and fundings, and the IRB process. Members additionally have the opportunity to join resident journal clubs to learn and engage with cutting-edge research directly from ED residents and attendings. Lastly, exceptionally committed members sometimes get the opportunity to engage in projects with emergency medicine faculty. Overall, the research committee is a place for growth and development of EMRA's research knowledge, and it's a great place to talk about what you're passionate in. I will now be passing it off to Abby for new member training.
Hi, everyone. My name is Abhi, and I'm one of the program leads who is in charge of the New Member Training Committee. So the New Member Training Committee, or NMT for short, is responsible for the immersive, individualized training experiences of new members. And it aims to equip new members with the knowledge and skills that they need to function independently on shift. So participation as a new member involves weekly training sessions that are about 4 hours, and you'll be partnered with a volunteer member who offers to be your trainer. In terms of the time commitment, aside from the weekly 4-hour shift, there will be required study time just to learn the protocols, the workflows of EMRA, and the ins and outs of the organization. And then there will also be a quarterly meeting for trainers because we're constantly learning and improving the process through feedback from both the trainees and everyone in the program. Our overall goals are to standardize and streamline the training and just improve every single iteration. And this is going to be one of the first committees that you interact with when you join the program. Now I'll be passing it off to Sarah for the mentorship committee.
Hello again, everyone. I'm going to be talking a little bit about mentorship, a committee I hold very, very near and dear to my heart. Mentorship committee is the largest EMRA committee, and it started out with simply pairing up younger EMRAs with senior EMRAs in our mentor-mentee pairings every quarter. And it eventually expanded to alumni mentorship pairings as well as resident mentorship pairings. So the mentorship committee now really encompasses a large variety of professional and personal development resources, workshops, and opportunities for EMRA members. The mentorship committee also facilitates greater connection with the physicians at Ronald Reagan through different avenues such as shadowing and attending EM resident conferences alongside the faculty. And we also have, as I mentioned earlier, a resident EMRA mentorship pairing program, which we have gotten a lot of really good positive feedback on. Recently, we've been able to reach the larger Los Angeles community through Bruins Against Fentanyl, where we distribute Narcan and fentanyl testing strips to hopefully prevent fentanyl overdoses. Moving on to the next slide. All right, a little bit more. So this is an outline of all the different events that we have and all the different resources that we have available for our members. So Mentorship Committee puts on a variety of seasonal programming and workshops throughout the academic year for members, such as we have an MCAT prep workshop. We have a Women in Medicine seminar. That's one of my personal favorites. We have case competitions where EMRA's discussed various issues in healthcare, and recently we just had our first one finally back in person. We have our AMCAS workshop and much, much more. So our ultimate goal with this is to foster greater connection between our members and the emergency department and to grow them in their strengths and professional aspirations. So we really want our members to be well-educated, well-informed, and well-rounded individuals in all facets of their pre-med journey. I will hand it off to Quinn Ann to talk about the marketing committee now.
Thank you, Sarah. Hi, everyone. My name is Quinn Ann, and I will be talking about marketing committee. So marketing committee really is our connection to UCLA student body and offers our members an opportunity to use their creativity along with their past experiences to really craft the portrayal of EMRA's vision. And so time commitment is largely project-based. We're always welcoming new ideas. So if you have anything that you'd like to bring to the table, we'd love to hear it. But ultimately, you're able to participate in as many projects as you'd like. A few examples of projects that we have currently are our health literacy infographics, interviews with physicians, which are a great way to learn more about different specialties, and fun recruitment graphics like you might have seen thus far. Now passing it off to Philip for Education Committee.
Thank you, Quinn Ann. I'm Philip, the head of Education Committee. The purpose of this committee is to oversee a variety of opportunities and projects for EMRA and the public. We hope to educate more about healthcare topics and its intersection with other medicine-adjacent fields. So some projects we've had in the past include a fully fleshed out resource such as the COVID Demystifying Social Media Initiative, and a more recent event we've had was about the intersection between entrepreneurship, biotech, and medicine. There is one main project chosen to be carried out per quarter, and there are many opportunities for leadership in specific areas of interest. We don't have scheduled meeting times, but members choose how much time they want to devote to their projects and schedule their own meetings with their teams. Now I'll be passing it off to Ibrahim to talk about what EMRA is looking for.
Thank you, Philip. So we seek individuals who are passionate about medicine and healthcare, about the research we do in the hospital, and about the specifics of our program that make us stand out from other organizations on campus. We also look for individuals who show this passion through their dedication to responsibilities they take on and through their dependability in those commitments. I'd also like to add that communicating efficiently and conducting yourself professionally are essential not only to being a stellar member of this organization, but also for future careers. Finally, we also look for individuals who take on different opportunities to make the most of their experiences, who show attention to detail in the tasks they take on, and ultimately those who make good judgment calls, whether they are inside or outside the hospital. And now I'm passing it off to Mudupe to talk about time commitment.
Thank you, Bob. So we know that many of our applicants have busy schedules, so we wanted to clearly outline what we expect from our general members throughout the year. EMRA has a 1-year time commitment beginning at the completion of your training, including all holidays and school breaks. This equates to about 8 hours a week, which includes a 4-hour hospital shift working in Ronald Reagan Medical Center, where you will be actively enrolling patients into studies. A 2-hour clerical shift where EMRAs catch up on paperwork and ensure that all aspects of the EMRA role with regards to the clinical studies are fulfilled. Since returning to our in-hospital duties, we have not had clerical shifts, but we are actually starting clerical shifts up again this quarter, so that's definitely something to look forward to. In addition, members are expected to dedicate about 2 hours to staying up to date on studies, reading through protocol updates, and changes to shift duties. And lastly, EMRAs are required to attend 2 general meetings, which are about 2 to 3 hours long, and include presentations by incredible guest speakers, any updates regarding the progress of our studies and committee projects, as well as the opportunity to interact with fellow general members. So outside of these 8 hours a week, general members do have the opportunity to get involved with committees and take initiative by leading projects they are passionate about. We strongly encourage our members to be more involved because it's an excellent opportunity to grow both personally and professionally, but they also have the flexibility to take on as much or as little as they'd like, as long as they are meeting the hour commitments listed on the slide. Now, as we've mentioned throughout this presentation, EMRA is a program that runs year-round, which means members are responsible for summer, winter, and spring break shifts. So if you are an international student or you're worried about not being able to go home, we want to assure you that we do have solutions. Members often double shift or cover each other's shifts so that they can take a few weeks off from shift duties. Lastly, we want to emphasize that deferrals of admission are not allowed. If you are accepted into the program, the onboarding and training process begins as soon as you receive that acceptance email. So please do keep that in mind. Next slide, please. So we typically accept about 10 members depending on the current size of the program that particular cycle. And this is in no way to make the program more exclusive or less accessible to students. A lot of the resources we offer are dependent on external factors. So our working together with the emergency department dictates how many members we can have that can be trained extensively to do the work that we do. Members are accepted into the program officially when they have trained in the emergency department and have shown their ability to carry about the shift duties required of an EMRA. And lastly, we'd like to emphasize that reapplicants are highly encouraged. We look favorably at reapplicants as they have put in the time and effort to apply into our program, even if we were not able to accept them the first time. And I'd like to pass it back off to Bob.
Thank you, Mudupe. So some logistical things that the UCLA Health Volunteer Office requires of all of its programs are that first, members are required to have an updated TB vaccination or a test within the past year. Also, if you are currently already a volunteer through another program affiliated with a volunteer office, such as care extenders, we ask that you get a reference letter from your program coordinator to make sure you're in good standing with their program and that they are okay with you being in more than one program at once. Also, if you are in another program, you must have completed the minimum requirement for it before applying to EMRA, which is usually around 1 year. And lastly, you must be at least 18 years old to apply. And now I'm passing it off to Mirsal to talk about the application process.
Thanks, Ibrahim. As for our application process, our application will be available online on our website at 11:59 p.m. on Friday, April 14th. It will be open for 1 week and it will close on the 21st. Unfortunately, no late applications are accepted, so please try your best to submit your application at least 30 minutes ahead of time. If you have any questions, concerns, or significant obstacles regarding this application process, please let the coordinator team know, and we will do our best to address these. We would also like to note that we do review our applicants holistically, and GPA is not a screening factor. Please note that we look for individuals based on their character and values rather than a skill set they may or may not have. We will also be requiring contact information for 2 to 3 references for this cycle. For more information about the initial stages of the application process, please email us or DM us on Instagram. Now I'll be handing it off to Fred to talk about the later stages of the application process.
Thank you, Mirsal. So for the spring 2023 cycle, primary interviews will be conducted via Zoom and secondary interviews will be conducted in person. Decisions for primary interview invites will be sent by April 30th, and decisions for secondary interviews will be sent by May 6th. Those selected for a primary interview must provide their unofficial transcript. And although we request transcripts, I want to once again emphasize that GPA is not a factor we consider. We evaluate applicants in a holistic manner and based on their meaningful experiences, whether those be academic, personal, or otherwise. We are here to understand your story, not filter applicants based on specific qualifications. With that being said, prior research and or medical experiences are not required. I will now pass it on to Kunan.
To make sure to stay up to date with our recruitment process, make sure to follow us on our social media. So you can either use this QR code, which will also take us to the website, which has additional information about our recruitment process, and follow us on @EMRA UCLA on Instagram. We'll always be announcing any upcoming events where you can come ask questions.
We hope this informational video was comprehensive and answered many of the questions you may have. We will also be conducting information sessions where program leads will be answering your questions live, and the questions can be submitted to the following link here. The link will also be posted during the information session so that you have access to the form in case any questions arise during the session. If you have a more personalized request that you believe is more appropriate on a private matter, you can go ahead and email it to UCLA EMRA staff at mednet.ucla.edu. The email is at the bottom of the slide, and the program leads will take a look and respond accordingly.
All right, I would like to thank you all for joining us today. Hopefully you found this, as Abby said, hopefully this has been informational for you. We will be available again at our live information sessions. We do hope to see you there. We do hope to field your questions at that time. Thank you again.